Hi, my name is Dr. Christopher Kim. I'm one of the vascular interventional radiologists here at the Vascular Institute, and today I'll be speaking to you about prostate artery embolization, or PAE. Prostate artery embolization, or PAE as we like to abbreviate it, is a minimally invasive way and a unique to interventional radiology way of treating benign prostate hyperplasia. The medical condition is really a continuum of a very large disease that affects many men, age usually 50 and up. The treatment is unique in the fact that we target the prostate from a totally different way normal urologic procedures are able to target the prostate and go through something called a catheterization rather than going through the urethra. As far as an ideal candidate for prostate artery embolization, there's a wide range of people that qualify and are suitable for the procedure, because it's a unique procedure in the fact that there isn't really a size minimum or a size maximum for the prostate gland. For many of the procedures that are on kind of the spectrum of available BPH treatments, there's specific size criteria or different characteristics of the gland that need to be met for the procedure to be effective. The unique aspect of prostate artery embolization is, since we target the blood supply of the prostate, almost all types of prostates, no matter the size or shape, are able to be suitably decreased in size and softened through the procedure. For the actual procedure of the prostate artery embolization, as well as kind of the beforehand, getting you ready for the procedure, as well as the immediate aftercare, I would say it's a very minimally invasive procedure. We typically start a day, if you're on our outpatient schedule, at 7:30, you'll be arriving at our office. We'll get you ready for the procedure, go over some pre-procedure instructions, some day of procedure instructions regarding what's going to happen in the room. We typically do things with either light anesthesia or conscious sedation, and overall the procedure takes about an hour to an hour and a half. There's no real surgery, quote unquote. Everything is through a minimally invasive pinhole through either the wrist or the groin. And the recovery period is actually often longer than the actual procedure because we like to monitor you just to make sure that from a bleeding standpoint, from a groin access standpoint, everything looks great from both ends. Some of the benefits of prostate artery embolization over the traditional treatments for BPH, or some of the minimally invasive treatments that are also offered for BPH, are that prostate artery embolization is one on the spectrum of different procedures, very minimally invasive. I'd likely rank it as one of the least invasive procedures available for BPH. Two, it can be applied to pretty much all glands. And three, it has unique properties in the fact that it often treats different symptoms besides just BPH. Hematuria, for instance, which is blood in the urine, can be treated effectively with prostate artery embolization as well. Some of the risks and potential side effects of prostate artery embolization are almost all related to just the general groin access, the vascular access. We do a very small catheter through the groin or the wrist, but it is in the arterial blood supply, which is under high pressure. So we take great care and caution in making sure that after the procedure is complete, our access site is fully hemostatic or not bleeding before you leave. Really, the only risk of the actual prostate artery embolization as it relates to blocking off the blood supply to the prostate is something called non-target embolization, which is a fancy way of saying some of the particles we use to block off the blood supply that are supposed to be directed towards the prostate end up going towards the bladder, the rectum, the adjacent blood vessels to the prostate artery. Over many studies and many years, it's been actually shown that essentially non-target embolization has no real long-term outcomes or significant side effects. All it really does is, for the first couple of weeks, lead to mild irritative symptoms. The typical recovery after a prostate artery embolization is fairly quick if you break it down in two different segments. The physical recovery is same day. You're actually leaving our office the same day. It's a same day procedure. And you're walking around and you're doing everything pretty much normally. Because of the access site going in through an artery or a blood vessel, we like to say don't go run a marathon, don't start squatting the next day. But you can continue your normal activities of daily life, go upstairs, walk the dog, do anything like that. you'll be back to full activity typically within a week from a physical standpoint. From a post-procedural standpoint, when we actually block off the blood supply to the prostate, it produces something called a post-embolization syndrome. Essentially, we're actually aggravating your prostate by blocking off its blood supply. It gets temporarily inflamed. Because of this, all of your voiding symptoms, getting up at night, weak stream, hesitancy, all the symptoms of that nature actually increase for about 3 to 7 days. And we manage that with a lot of non-steroidals or anti-inflammatory medications. Generally by day 10, most people are completely recovered from any symptoms related to the procedure. And by week 3, are noticing a significant improvement in their voiding. At the Vascular Institute, our post-procedural follow-up protocol is fairly rigorous. We do a post-procedural phone call at 24 and 48 hours, and we schedule our first follow-up visit in our clinic at 6 weeks. We found that typically this is the time where most patients are recovered from all of their post-procedural symptoms, the post-embolization symptoms, as well as are starting to notice significant improvement in their voiding. And what we often do is show you the comparison of the objective score sheet that you had prior to the procedure, where you're filling out all of the symptomatic scores from a urinary standpoint, and showing you afterwards at the 6 week, when we have you fill out the same score sheet, the noticeable difference and reduction in the score. PAE as a procedure as it relates to BPH is generally suitable for almost everyone. Really, the only technically limiting factor of PAE is generally in folks that are much older in age or have a history of smoking or prior smoking that actually have blocked off blood vessels that lead to the prostate arteries. A lot of the time, these internal iliac arteries, as they're called, are asymptomatic if they're blocked off, and people would never know. But what tips us off is often, advanced age and a history of smoking. And if that is the case, we typically order pre-procedure imaging to make sure that we're not putting you through a procedure only to not be able to accomplish it the day of. I think the most important message I would give to patients that are considering prostate artery embolization or PAE as a treatment option is to recognize that at the Vascular Institute, everything we do is in a multidisciplinary fashion. So the vast majority of our referrals are actually from urologists, because as a team, we understand that there are multiple different procedures out there for BPH, and prostate artery embolization might not be the best one for you, or it may be a good option for you. And the only way we would know that is by working together with not only other interventional radiologists in our group, but other urologists out that we're often working with both at the hospital or in the outpatient setting. I'm Dr. Christopher Kim. Thank you for watching our video today. And if you have any further questions, please visit us at vi-ami.com.